changes with Social Security disability benefits, SSDI, SSI. So we're going to get into those today. We're going to talk about what they're talking about changing, what they have changing, the new policies, the issues with getting help and all things disability. This is also a live Q&A. So I've already got a bunch of questions. I'm going to try to focus on disability questions here because we've got a limited amount of time and we're going to be talking about a lot of stuff. And if you're watching this on a live Q&A, make sure you type your question in the chat and I'll get to as many as I possibly can within the next hour. If you're watching this on a recording later, then type your question in the under YouTube comments. And in a couple of 3 weeks, as soon as I get enough questions, I'll do a follow-up question and answer session and answer as many questions as I can get to. Well, I'll try to get to all of them. And also, we want to see how it's going on out there with all of these changes and limitations and staffing issues that at the Social Security administrations, at the DDS and everything. So if you have a pending claim, tell us how it's going. Have you been contacted? Have you been waiting a long time? If you're filing a new claim, are you completely confused? Is Social Security helping you? Do you know that did they explain the difference between SSI and SSDI and SSA and DDS? If you're appealing your claim, if you're doing the reconsideration, you're doing an administrative law judge or the appeals council, if you're waiting on your continuing disability review, let us know. If you recently did a continuing disability review work or medical CDR, let us know how that's going. If you're waiting on yours, if your disability case claim was ceased and you're doing the expedited reinstatement, the EXR, how's Medicare in terms of Medicare Advantage, Medicare Supplement, working, any and all questions about all disability. We're going to get to a bunch of these today, but we want to get a feel of how it's actually going out there so we can address the issues and get you all as much help as we possibly can. Okay, so let's get right into it. Yes, there is a lot of changes currently with the current administration. The current administration, the Trump administration, when he was president before, they tried to do a lot of things, limitations on Social Security disability benefits. They just ran out of time, didn't focus on it, didn't do anything under the first term. Seems as though they're correcting those mistakes or that policy, or you may not think it is a mistake, but anyway. So now they are really going forward and making a lot of changes, attempting to make a lot of changes. One of the things I talked about a few days ago is that they're trying to rewrite the rules, the eligibility requirements, specifically for those, the start is for those 50 and older. Traditionally, Social Security, if you're 50 and older, then it's more difficult to get a job than if you're 20 or 30 and have, X disability. So sometimes a disability is obviously, a tragic accident or something like that, where you just, can't move at all. Then obviously doesn't matter how old you are. But if you have kind of a borderline thing in your 30s or 40s, then you're usually denied because they think you can get a job. But the older you get, the more difficult it is. So that little borderline thing that could go either way, sometimes they approve that for disability. They're talking about getting rid of that. And that might affect people if they're going for public comment soon. So make sure you reach out to your politicians and tell them how you feel about that either way. But this is going to affect people if it passes, filing for new claims for disability benefits. And they're also talking about it, making it kind of retroactive, not really retroactive, but for people that have continuing disability reviews going forward. So if you have disability benefits and you've had it for 10 or 20 years, and now you're 53 or 54 years old, they might start looking at things a little bit differently. So we want to get an idea of what's going out there and, reach out to your politicians and tell them how you feel about this, that, or the other. I also did a video a few days ago talking about SOAR, and those are the people. It was a federal program that the money was cut, and that was a program to help people that are homeless and on the verge of homelessness. apply for Social Security disability benefits and help them go through the entire process. But unfortunately, that has been cut. And then we've got staff cuts at Social Security Administration. Regular viewers know about this. Social Security was already at a 50-year low before Elon Musk and Trump and Doge came in. But now it's even worse. We're looking at about 7,000 people out of the program, out of Social Security. And these are the people that traditionally helped you, or some people would say, well, they never helped. But anyway, again, they were at a 50-year low even before the current administration. So it's difficult to get help. And so that's what we're doing here today. All right, so ISM. They're also trying to roll back a policy, in-kind support and maintenance. So people receiving SSI, and I'll get what the difference is for SSI and SSDI here in a little bit. But ISM is SSI. It's if you're getting some type of food help or housing help. They started counting it differently within the last 18 months. The current administration is trying to roll that back, and that will, detrimentally hurt a lot of people. They'll lose a lot of money on a monthly basis. And then CDRs. If you're lucky enough to get approved, or unlucky enough to get approved for disability, that means you do have a disability. But if your disability is approved, then you will have to go through the CDR process every now and then, every year, 3 years, 5 years, 7 years, whatever the case may be. And what they're looking to do is increase that. And I'll talk about that in a little bit. Okay, let's go through this systematically. I'll try to go through this list as relatively quickly as possible so I can get into your questions and everything. Looks like someone in the Q&A said they just lost their, Paul says, feeling kind of down today. Oldest and favorite brother passed away at 74 years old. He was a Marine. All right. So I always feel for those Marines out there. As we used to say in the Marine Corps, all Marines go to heaven because they already spent all their time in hell. So anyway, so there's perhaps a consolation. Sorry to hear about your brother. Okay, so new initial claims. Social Security is still doing the claims. The difference between SSI and SSDI, a lot of people don't understand that. In Social Security, the employees just don't have enough time, unfortunately, to explain it. If you file a claim through a Social Security employee, you schedule an appointment, everything like that, then they're really cutting back on the time they're allowed to help you. I mean, it used to be an hour and some. They would schedule an appointment every hour and a half or something. But now, from what I've heard throughout the country, they're giving you like 45 minutes. So they're just going, it's a sweatshop essentially, because they've got no staff. They've got, 400 other people to help. So they're not doing a great job in explaining all of your options and what the programs are. And here's one of the biggest mistakes. People don't understand between SSI and SSDI. SSDI, Social Security Disability Insurance, is the program you paid for through FICA taxes, payroll taxes. SSI, Supplemental Security Income, is a welfare-based program that Social Security administers, low income, low resources. When you apply for Social Security disability benefits, the employee always addresses both programs. If they didn't address both programs, I'd be the guy that, or one of the other supervisors, would go over there and say, hey, Bob, you didn't address both programs. Why didn't you? And what that basically means is if someone files for disability benefits, they ask you if you are also eligible for SSI, the welfare-based benefits. If your Social Security disability benefits could be over $967, you're not eligible for SSI because that's the max you can get. If your spouse is married and you're working, if you got other income, other resources, then you're not eligible for the SSI, the welfare-based program. And what they'll do is, here's what they mess up, is you apply, and then you go home, and then a few days you receive a denial letter. And you're like, those dirty rats. I just applied 3 days ago and they already denied me. No, that, if you read on the top, it says SSI, Supplemental Security Income. They denied you for the welfare-based program, but hopefully they're continuing off the other program. So the Social Security employees should do a better job of explaining that to avoid the follow-up calls and, all that. And stop with the social media, internet myth about everybody's denied the first time. We've got people on here, regular viewers, that would approve the first time. I've approved I've taken hundreds of thousands of disability claims. Some people were approved the same day, the next day, within a week. Unfortunately, most people, it takes months and months and months, and it's getting even worse. When I used to take disability claims a few years ago when I was still working, we used to tell everybody at that time, told people, you'll get a decision within 3 or 6 months. Now, everybody's being told 6 to 9 months, if you're lucky. Completely unsatisfactory, as we used to say, unsat in the Marine Corps. So if you're in the middle of a new claim, if you're looking to file, people always ask me, do I need a lawyer? If you want to hire a lawyer to file a new claim, more power to you. But I always recommend going online. You go online, you answer all the questions, you have everything there. Do it as soon as possible. Don't wait for your doctor's appointment next week. Don't wait for this test. If you think you're disabled, start it, because you've got that 9 months you're going to have to wait. So the sooner you start, the better. And if you wait a month, you just might lose a month of benefits if you are approved. A lawyer, if you're approved, if they will take you, this is one of the tricks kind of lawyers do with the language. They say if you get a lawyer to help you, there's 50% more chance you get approved. Well, if you call a lawyer, anybody who's ever called a lawyer and filing for disability, they ask you a bunch of questions. And if it doesn't look like you're going to get approved, they don't want to deal with you, because they only get paid if you get approved. So if 100 people call and 50 of those people, it's like, yeah, it didn't look like you're going to get approved, so no, I'm not going to help you out. You just have to do it your own. And the other 50 are slam dunks. They're going to take that and they're like, yeah, I got 100% approval rate. Yeah, it's because you only. So not all lawyers do that, but anyway. That's how they kind of play around with the statistics. Allegedly, I don't want to get in trouble with a bunch of lawyers out there, but anyway, so you can use a lawyer if you want to. If you're approved, they get 25% of your back pay, up to $9,200. So I always recommend people, the initial claim and the reconsideration. You can usually do those yourself. We're coming up with a program here. I've got a former Social Security employee, Mai Jackson. She does one-on-one appointments. That's about the only thing we do charge for. She charges for that. We're thinking about adding disability. So getting people help with filing for disability benefits, helping them go through the CDR process, going through the appeals process, kind of a consultation. We're kicking around that idea. If you're interested in something like that, make sure you type it in the comments or the live chat there. Okay, so that's for a brand new claim. What about a pending claim? If you've already filed last month, 3 months ago, 5 months ago, whatever, 2 years ago, unfortunately. What's going on with your claim? Another thing that Social Security doesn't explain is the whole process. When you file a new claim, it's filed to your local Social Security office. Do it online, over the phone, in office, whatever the case may be. And then that Social Security employee takes everything and sends it up to DDS, Disability Determination Services. That's a state agency that makes the actual medical determination. And they might have you do a CE, which is a consultative exam to see one of the Social Security contracted doctors. Medical records, people always ask me about medical records. I probably wouldn't send medical records to the local Social Security office because they have a tendency to be lost. Send everything up. Number one, when you file, in terms of medical records, when you file for benefits, one of the forms you will sign is the SSA 827, a request for authorization to release medical information. And the DDS, the Disability Determination Services, they use that to request the medical records from your doctors, clinics, hospitals, and everything. So that gives them authorization, HIPAA, status and everything, gives them authorization to get that medical evidence. So you don't necessarily have to provide it directly. But if you filed, your case is pending, and now you have some new medical records because you just went to the doctor last week or went to the emergency room or something like that, contact the DDS, find out who the claim examiner is, and they will send you a barcode. And it's a barcode, a fax barcode. And then what you do is you take your medical records, you slap that cover sheet barcode on there, and you fax it to DDS, and then it goes immediately to your particular file. There's codes on that barcode that it'll go to directly to your file. Always use a fax with a confirmation. So go to wherever, and once the fax goes through, it'll print off a confirmation receipt that it actually went through. So just to double check there. Okay. So if you have a pending claim and you're worried about what's going on, again, the Social Security Administration, your local office, Social Security office, once they send it up to DDS, it's kind of out of their hands. It's at DDS. So I would contact the DDS and find out who's got your case, and they have massive turnover as well. States run those agencies, and yeah, those people don't get paid a lot of money, so they get a lot of turnover, budget cuts, and they're having a hard time keeping up as well, unfortunately. And this is how the whole program has been designed by politicians to be terrible, so you hate it, and makes it easier for them to privatize everything, give it to their buddies on Wall Street. So that's, and we keep falling for it. But anyway, not on our community. We're smarter than these politicians, which is not saying a whole heck of a lot because they're not that smart. But anyway, we're smarter than them. So reach out to your DDS claims examiner, and just, even after you file a brand new claim or something, just reach out to them like 2 or 3 or 4 or 5 weeks later and say, hey, just want to say, hey, I just want to make sure my, my claim got up there from the local district office, the Social Security office, and that's my correct phone number. And by the way, I'm going to go see a doctor next week, and can you send me a barcode, and so I can send it in, and just kind of touch base to make sure it's going okay. And if you have a pending claim that's been there for a while, you should do this as well. Just reach out to the claims examiner, find out, what's going on, status and everything, and that'll help get things going. Okay. And if you got any questions on that, there's a million other permutations on new claims and pending claims, so make sure you ask it in the chat or in the Q&A later. All right, appeals. If you're denied for your disability claim, then you can file an appeal. The first stage is super, super easy. It's an SSA 561. I've got it on my website, mygovexpert.com. Let me pull it up here. So on my website, mygovexpert.com, and it looks like it's up. I guess Amazon Web Services was broke for a while, and now everything's back up again. So that's a beautiful thing. So here are the 4 levels of appeal. And this is same kind of stuff as on ssa.gov, but I think mine's a lot easier to read. So the first level of an appeal, so you've got the initial claim, you're denied. And then the appeals, there's 4 levels. The first one is the request for reconsideration. Super, super easy. It takes you about 10 minutes to do this part of the appeal. It's SSA 561. Let me make sure the link still works. So this is it. Super, super easy. You see, if you only got like 3 lines there to fill out the reconsideration. So if you've got more, just write in here, see attached, and then attach a piece of paper on there. And if you want, but don't get too lengthy, don't get too lengthy. Be very succinct. Because the employees just don't have time, unfortunately. Yeah, it's pathetic, but that's the reality. Politicians have put the agency in. So the request for reconsideration, easy one. If you're denied there, then you go into the administrative law judge, and another 5. That's the time. It's probably a good idea to go ahead and get a lawyer. And I always recommend kind of a local lawyer, someone that kind of knows the local judges. Now they're kind of doing, internet, type of, so things are kind of changing, but the ALJ is probably the time to get a lawyer. And then the next stage is called the Appeals Council back in Falls Church, Virginia. They just review what the administrative law judge said, make sure they did everything correctly. And then the last one is the federal court review, which also, I guess, includes the Supreme Court, if you so choose to go that far. So that's the appeals process, different levels there. So anytime, anything, Doesn't matter, Social Security, disability, retirement benefits, survivor benefits, Medicare, Medicare Advantage, Medicaid, food stamps. A lot of people it sounds like they're going to be cutting off food stamps here in November because of the shutdown. That's going to be crazy. But anytime you get a decision you disagree with, please, 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 please fight it. And we're coming up with a new platform to help you all fight it even more. So make sure you subscribe and like and share and all that kind of good stuff. So, all right, continuing disability reviews. This is everybody's, one of the things they hate. When you're approved for disability benefits, they look at your particular case, your disability at that time, your prognosis and everything, and they say, okay, based on your situation, you may or may not get better in a year or 3 years or 5 years or 7 years or ever or never. So that's why they determine when your cycle is for your continuing disability review. And there's two different types of CDRs. There's the medical and the work. So if you start working, and Social Security can review that, and that's called a work continuing disability review. And then, but most people know the medical part of it, where they just review it on a regular basis to see if you are in fact still disabled. And here's the change that's happening during this administration. I've heard this from the inside, a little bird. So this is not necessarily public knowledge, but continuing disability reviews, they are increasing substantially going forward. So continuing disability reviews, my regular viewers know this whole situation. Congress has a separate budget for CDRs. So Congress says, okay, Social Security, you've got your staff and you've got the rent for the buildings and the electricity and water and all that kind of stuff. Here's the money to run your agency for a year. And it's always less than what's needed. But anyway, that's why Social Security has never been able to update their computer system. So, and here's another budget for CDRs. So CDRs, the continuing disability reviews, are a different allocation. So they say, okay, you're going to do 1 million CDRs this year, or 500,000 CDRs, and you have to do 1 million or 500. If we say you have to do 500,000, you better do 500,000, not 499,000. Yeah, we used to get harassed all the time if we went one over or one. We had to do exactly that amount, that quota. But now they're increasing these substantially, and at the same time, they're cutting back employees. So this is, CDRs, people that actually get them hate them, but we could see why they're a good thing to make sure people are still actually disabled. And so, make sure that money is good and for the trust fund and everything like that. So if you're not disabled, then they kick you off and, you have to go find work. And the idea is that, well, you're not disabled, so you can find work. So there's nothing wrong with that. But what's messed up is they're telling offices throughout the country to do more of these CDRs, but they don't have staff to do it. So I think they're going to be done in a really just a terrible method. The customer service is not going to be good. I'm not sure how else to say that. It's slapshot. It's not going to be good. So a lot of people are going to get CDRs, and they're going to need help filling out those applications, and Social Security employees are not going to be there, and stuff is going to get lost. And so it's fine doing more, but you have to have the staff to actually do more. And the politicians are not providing that. So I think it's going to be very, very difficult. So that's why we have this channel. And that's why we have our new platform coming up. We're going to do a big focus on CDRs so people throughout the country can help other people throughout the country, in particular states and other places, to help them navigate the CDRs. And again, we also have Mai Jackson, who is a retired Social Security employee. So you can schedule an appointment with her there. So talk to a former insider. You just type in there. Again, that's the only thing we do charge for. So she's got a few appointments on the 27th. So you can schedule an appointment and she can help you navigate retirement benefits, survivor benefits, disabilities, CDRs, and all the rest of it. So, all right. And then that money goes to for her help, and it also helps pay for the website and everything like that. So we appreciate it. So and for I know there's a lot of new people watching this, but let me explain about CDRs and why you shouldn't stress about CDRs. My regular viewers, I can put up there and they can explain this because I've explained this a million times, but I'm going to do it one more time for all the new viewers out there. Because CDRs are allocated specifically by Congress, a separate allocation, and I said, if an office has 100, they have to do 100 in a month. They can't do 99. They can't do 101. They have to do 100. If they do 99, they get called by their boss and said, why'd you do 99? You're short. So because of that, what happens is if an office has a quota of 100 CDRs they have to complete this month, then they send out like 200 packets to people. So if you're in that area, you might be the second 100 and you receive a packet and you fill it out and you stress it and you do this and then you spend hours and stressing it and fill out this and you return it and they don't do nothing because they've already filled their 100 quota. And you're like, why'd they fill out 200? Because a lot of people, if they sent out 100, you'd only get maybe 50 back because the address has changed. The person decided to go back to work and said, forget about it. Or, the mail never got delivered or whatever the case may be. So in order to get that 100 and not be called on the carpet, as we used to say in the Marine Corps, then they would have to send out quite a bit more. So once they filled that 100 quota, then they don't need yours. So even if, and this goes on the first part of it as well. You're like, my CDR is this month. I haven't received anything. Well, that means your local office doesn't have a budget. So no big deal. Even if you're up for a CDR, if you don't get it, that means, the local office. I would perhaps call it, make sure it wasn't lost in the mail or something like that. And that way you don't have any, trouble later. But if you call them up and they say, hey, by the way, I was supposed to get a CDR this month and I didn't get one. They say, oh yeah, we sent it. It must be got lost in the mail. We'll go ahead and send it out again. Or they might say, yeah, we don't have a budget. We've already filled our quota for, this month, next month, 3 months and stuff. So you're good for another year, I guess. So, so at least And then even if you send it in, you might be part of that second 100 and they don't do anything about it. So my philosophy is FCF. Forget about CDRs, forget about it. Complete it, make copies, complete it, send it in if you actually get it, and then forget about it again because they might not do anything. So don't stress it. Just do the best you can when you actually get the package and then forget about it after. So. All right. So, and if you're in the middle of a CDR, you're worrying about your CDR, you got any questions about CDR, make sure you type it into the live Q&A, or we probably got enough questions for today, but type it in to the comments in this particular video, and then in a couple of weeks I'll go through and then I'll answer all those, and we'll do another live Q&A. Or best yet, which everybody knows I love, is on my website on the bottom left there. Let me see if you can see it without me messing it up here. See the bottom left of the website, mygovexpert.com. You see that little question or comment thing? You click on that and you can actually record a question. You get a 2-minute recording. I've got a couple of those. I'll play here in a little bit and answer their questions. So. All right, where were we? We were in if your benefits have ceased, your disability insurance benefits. And I apologize for the acronym. So SSI, Supplemental Security Income, SSDI, Social Security Disability Insurance, DDS, Disability Determination Services, ALJ, Administrative Law Judge, AC is the Appeals Council, EXR is expedited reinstatement, DIB is disability insurance benefits, and FRA is full retirement age. Okay, let's get into the DIB ceased thing. If your benefits are terminated because of a medical termination, because of a CDR or something like that, remember, everything you can appeal. So if you disagree with the appeal, you appeal it. If your disability is ceased because of work, because you work, and we'll talk about working here in a little bit, If you work and you say, yeah, I was able to, push through my disability, I got a little bit better, and so I was able to work, so they cut off my disability benefits, you can do what's called an EXR. Within 5 years, if your disability benefits terminated because of work and you have the same disability, but after 5 years, 60 months, it just turns out, yeah, I tried working with my disability. I tried for a while, 5 years, but I couldn't do it. You're eligible for an EXR, expedited reinstatement. And I don't know why they call it expedited anymore, because there's nothing expedited with Social Security, but it is expedited reinstatement. And I have to warn you, Social Security employees hate EXRs because the process, it's all paper, because not that many people do it. And yeah. So don't worry about that. It's the Social Security employees issue. They just don't like EXRs because the paperwork to do it is just a nightmare. So, but don't worry about that. Just understand that it's not you. They just don't like the process of it. So anyway, and if you're applying for EXR, you're also eligible for presumptive payments. So while you're waiting for your EXR to be approved, they can actually turn your money back on. So, but if they deny you, then you might have to pay that back. So watch out for that one. And one of my video questions today, maybe I should show the video question that this applies to. Let me make sure I've got the right one. I think this is.
Hey Ed, how you doing today? Yeah, I just turned, well, February of 2026, I turned 66 years old, and I'm on SSDI. The question of it is, will they turn my disability into regular Social Security? And because I'm supposed to be 66 in 10 months.
Okay, so yeah, he asked that question, and that works out perfectly because that's what I was talking about today. So what a coincidence. Okay, so yes, when you're on disability benefits and you reach your full retirement age, so he says it's 66 in 10 months, and so I think he said he turned 66 in February, so 10 months, so that sounds like December, right? December of this year or next year. So whatever month is your full retirement age, then your disability benefits, you're denied, you're ceased, you're not denied, your disability benefits end, you're terminated, you're done with disability benefits. You still have the disability, obviously, that doesn't change, obviously, but it's more of a bureaucratic thing. They stop taking your money out of the Social Security Disability Trust Fund, and then they start taking your money out of the Social Security Retirement Trust Fund, Old Age Survivors Insurance Trust Fund. So it's a different trust fund. So just a more of a accounting type thing. But what's important is that you no longer have CDRs, continuing disability reviews, because you're not on disability benefits. You're on regular retirement benefits. So why are they going to give you continuing disability reviews if you're not on disability? So you don't have to worry about those ever again. Stop stressing. We get people here all the time. I'm 72 years old and I'm worried about getting a CDR. It's like, you're not. Your disability stopped years and years and years ago, and you're no longer limited to the amount of money you can make in terms of work, because you're not on disability benefits. You're after your full retirement age. So you can make $1 billion a month and it's not going to affect your Social Security benefits negatively at all. So no more CDRs, no more work limitations. Everybody is switched from disability benefits to regular retirement benefits. So I hear this all the time. I'm 72 years old. I'm 80 years old. I'm on disability. No, your disability benefits stopped like a decade ago. You're just on regular retirement benefits. And it's because people just don't know the switch, and which is fine, because their benefit amount stays the same, their direct deposit stays the same, nothing really changes, but they've got those two handcuffs off. No more CDRs, no more work limitations. And we can't tell you how many people say, yeah, I'm 70 years old and someone offered me a job and that job would have really helped me. And it's not that, taxing. It's not that, difficult, but I denied it because I'm disability. No, call that person back now and say, you'll take it. If you can work, do it, because you're not on disability anymore. So let's reach out to those people that are, that don't know that. Okay. All right. I promise I will get to your questions here soon, but we got a lot of questions. All right. Medicare or Medicaid or Medicaid. So when you're on disability benefits, you're eligible for Medicare after being on disability for 24 months. So the 25th month, your Medicare starts. In terms of, because, you get Medicare Part A and Part B, but there are a lot of gaps in original Medicare. The big one is that Part B, 20%. So if you get a $100,000 surgery, you have to pay 20% of that, $20,000. And people say, well, surgery's done in the hospital. Isn't it covered? Well, no, the hospital charges are covered by Part A, but the actual surgeon doing the surgery gets paid from Part B, and you have to pay the 20% there. So if you're on disability, in most states, the only thing you can get is a Medicare Advantage plan in most states. Once you hit 65 years old, then you can cover those original Medicare gaps with a Medicare supplement plan. Those are the plan N and G and F and all that stuff. But in most states, all you can get is a Medicare Advantage plan. So make sure you get the right one for you. If you have a current plan, this is also the annual enrollment period for 2026. If you want help, reach out to Chapter. They sponsor this live Q&A and help us with the website and all that kind of good stuff. So, so if you're looking to change your plan for 2026, you want to review your plan, call Chapter, call whoever, but review your plan for 2026. There's a lot of changes. Make sure you get your providers you want, you get the prescriptions, you save as much money on your prescriptions. Make sure they're covered. If you have a pharmacy you want to use, if you have priorities, you need more dental, need more vision, check all the prices, not just that it's a zero premium. Check how much it is to stay in a hospital, how much it is to get an MRI, a CT scan, how much a specialist is, and stay persistent throughout the year. When you have a Medicare Advantage plan, often you have to fight for prior authorizations and networks and all that kind of stuff. That's the trick of Medicare Advantage plans. Some people love them, but yeah, we're going to have to fight to get those benefits that you paid for. And that's one of the things that Chapter does, is they have member success team there that helps you fight the prior authorizations and fight the insurance company to make sure you're taken care of. So, all right. And remember, people can get Medicare and Medicaid. If you're having a hard time paying for that $185 Part B premium, not sure exactly what it's going to be next year, probably a little over $200. But if you're having a hard time paying for that, then make sure you reach out to Medicaid, your state Medicaid office, whatever they call it. There's different names, different states. Reach out to them and apply for Medicaid. And if you're approved at the higher levels, they will pay for your $185. And you can have Medicare and Medicaid. Millions of people have Medicare and Medicaid. Then they're also eligible for Medicare Advantage dual eligible plan. And in most areas, those are the ones with the most cost savings and benefits. So, and you can reach out to Chapter. They can help you with all that. Okay, working. This is the tough one. This one, I'll go as quickly as possible because I know I'm going to have a whole bunch of questions on that. But I also have on my website a couple of guides. So you click on disability there on my website. Again, this is on ssa.gov too. If you want to go to SSA directly, that's fine too. And you click on working and benefits, and it has my guide there that I wrote in semi-English that explains all the different steps, the trial work period, the extended period of eligibility, all the rest of it. And I've also got a little SSDI calculator there that you can tell, that you just put in the information. It tells you about your work, whether that's trial work period and all the rest of it. So all this information, all this, the guides and everything are 100% free. You don't have to subscribe to, you don't have to give me your emails so you can work the calculator. You don't have to do any of that. But if you want to support us, that's awesome. We appreciate it. All right, let's see. Where else are we? And I think we're in our time for questions. So remember, yeah, if you're watching this on a recording later in YouTube, ask your comments there. I'm simulcasting this on a bunch of different platforms, but I really focus on YouTube. So sorry for all that for all the rest of you people out there. So. All right, so let's get into some questions. Let's see what we got. Let's see here. Raymond, Donna from Utah. I'm 75, had an emergency hospital stay in June, needed a pacemaker hospital, was in network with my Advantage plan, and surgeon cardiologist was not. James from Chapter found me a plan. Okay, yeah, that's the American healthcare system is just terrible. I mean, you go in there. And, you say, okay, you need X, Y, and Z. And you say, is the hospital covered? Yeah. Is the doctor that's doing the surgery or the procedure covered? Yeah. And then you find out the anesthesiologist, who's a different person, it's not covered. So it's crazy. But yeah, sounds like James from Chapter help you found someone. So that's awesome. Thank you. I appreciate it. Thank you for letting me know. Rick, we don't know how long this shutdown is going. SSA didn't process my 131 form paperwork in time, and SSA started taking out half of my check. Can I call and appeal? It's too much. Yes, but I don't think it's necessarily an appeal. So a 131 is a special wage payment form. Yeah, I still have the form numbers in my head. It's a scary thing. That's what happens when you do this a million times. So it's a special wage payment. So basically, Rick is under his full retirement age, and he started his benefits, Social Security benefits, and he was limited to the amount of money he can make once he started his benefits. And it was either the monthly or the yearly or something, but he went over that limit. And the reason he went over that limit is because his employer paid some back pay or some, leave or sick leave or something like that and sent him a check while he was receiving Social Security benefits. And Social Security looked at that and says, hey, you said you're only going to make, $1,950 a month, $1,950 a month. You made $4,000 that month. So you owe us money. And he filled out the form, did the right thing, sent it in, but they just haven't processed it yet. So it's not really, I don't think in your particular situation, it's at the appeal. You just need them to process that special wage payment, to go in there and do the input. And once the input is done, then it clears everything out. So I don't think it's at the appeal stage where you have to appeal because the decision hasn't been made because they haven't processed it. So just call up the office and say, hey, I need that money. It wasn't supposed to be withheld. It was a special wage payment. Social Security, I mean, give you the inside the baseball tips here. Those are not done very often. And because Elon Musk and Doge and everybody kicked out so many of the most expert people in Social Security, a lot of the offices are, struggling to find, expertise. And those forms, the Social Security employees don't get that often as compared to other forms. So I'm just hoping it's not on, someone's desk just sitting there because they don't know how to process it. It's actually an easy form to process. So you just need someone to process it. That's it. You just need to call and say, hey, I can't live on this. I've got the form, process it. If you've lost the form or if you can't find it in the office, whatever the case may be, let me know. I'll fill it out again. I will bring it down. But you just need them to fill it. You just need it to process. So. And this is Paul here. Lost his Marine Corps brother. My spouse is on Social Security disability and is 65. Is there a chance he will lose his disability with this administration? If the only way someone that's currently on disability is they can lose it is if they, start working over the substantial gainful activity, or they get a CDR and they determine that you're no longer disabled. Other than that, they're unless they change the law, they're not supposed to. They're not allowed to unilaterally go in there and say, "Hey, we're going to kick everybody off of disability." Yeah, they actually have to go. You have to actually have due process. And people ask all the time, "Well, I'm 65, 66. Will I still get a CDR?" Yeah, if you're up, if your time is up, in terms of that's not a good way to put it, but if your sequence your disability CDR time has arrived, it doesn't matter how old you are, particularly if they need that quota, if they have to fulfill that quota. Again, this is by Congress. It's one of those things that they, if they say Social Security Administration throughout the country has to do 1 million or 750,000, then they have to do that. So, all right, let's see here. I've got tons of questions. I jump around on the questions, so I apologize. I send you that. Okay, I got. Let's overloaded yourself tonight. That's a lot of info for people to remember. Yes, yeah. So that's why I do the. Yeah, but each category. So yeah, there's a lot of information, but each the people receiving disability benefits know what category. So they probably just tuned me out when I talked about initial claims if they're dealing with an appeal, and so yeah, I understand. So let's see here. What else? I'm 65 in SSDI and just went back to work part-time. So what will change? No, you're fine. As long as you stay within the regulations. If you're receiving disability benefits, you are allowed to work. Congress says you are allowed to work, but you just have to stay within the regulations. And on my website, it has all the details there, but it's, basically you have a trial work period. So for 9 months, and not necessarily consecutive, you can work a month, take off a month, or another month, but it's the months you work, 9 months, those 9 months, you can make as much as you want, and it doesn't affect your disability at all. And the trial work month trigger is $1,160 for this year. So if you make $1,159, you can make that amount forever, and it won't affect your disability benefits. And well, actually more, because next year the trial work period month will go up a little bit, the threshold. But if you make 1160 or more, then that triggers 1 month. You've used one of your 9 months. So because everybody wants you to be able to go back to work. If you're able to go back to work, a new medication, a surgery, you're just feeling better, whatever the case may be, it benefits everybody. Most importantly, you, if you're able to go back to work. If you're not, then that's what disability is for. But if you're able to go back to work, you go back to work, you make more money, you pay taxes. Everybody loves when you pay taxes. You don't take Social Security money out of the disability trust fund. So it's good for everybody if you're able to go back to work. That's why they have all those, the incentives to go back to work. But you just have to stay within it. So you have 9 months, you can do whatever you want. So check out my website, check out the ssa.gov. Again, it's kind of hard to understand because they write it in bureaucratic English. But yeah, you're good. Stephanie, who's a member, you are too awesome, Stephanie. I appreciate it. I have never had a review. 10 months away from full retirement. I was told I can never work again. Will they make me do a review? If you've never had a review, I don't know how long you've been on disability, but yeah, if you're 10 months away from your full retirement, there's probably a less than 1%. As I mentioned, the current administration is making the offices throughout the country do more CDRs. So you haven't had one before, but offices are going to start scrambling to do more. But probably not. Knock on wood. You're probably good. So remember, once you hit your full retirement age, forget about all that disability BS. No more CDRs, no more work limitations. If you're able, something happens and you're able to go back to work, go for it. So, True, good afternoon, and fellow Weirians. Is there any way we can donate to Bella, telling to send her a little something to say we are all thinking of her? We appreciate you and your sons and wife. True. Oh yeah, Bella was in the hospital yesterday, and everybody was thinking about her, singing and all the thoughts and prayers. And so, guess she's still in the hospital. She was supposed to get out there, but yeah, we had someone. Yeah, if y'all want to do that outside, then more power to you. Absolutely. That's what we're all about here, is helping people out. So, Semper Fi, you're up, Paul. Can you please explain the proposed CPIE calculation changes that are pending? Yeah, and I don't think they're pending. What are the advantages of the CPIE compared to the CDPPIW calculation? So, yeah, the way COLA, the cost of living allowance, that they're supposed to announce here in the next few days. I'll do a video when they announce that. It's based on the consumer price index for workers. So for just clerical workers. And the CPIE is consumer price index for elderly. And the argument is, which I agree with, elderly pay more for health insurance, health, everything. And so if the COLA used the CPIE instead of the W, COLA would be higher. Some years it wouldn't because of the health cost, but anyway, overall they would estimate that your benefits would be higher if they actually used the E, the elderly one. And I agree with that. So, particularly now that health, it's really going to make it, some years previously it didn't make that much difference. So people say, no, it doesn't make, but I think healthcare costs are going to be going up considerably. There's something, the 70 million Americans born between 1946 and 1964. So, and the government of any state expecting young, able-bodied people to just go out and find a job with insurance don't realize how difficult it is for that generation to find jobs right now. Yeah, it's even worse now with AI, and you got all these companies out there that say, we're not going to hire anybody because we got AI. And then they find out that, as I have found out, I'm sure you'll find out that AI sometimes is okay, but it gives crazy answers sometimes. But the corporation's already saved all that money not hiring people, and, the people in charge of those corporations already pocketed the money, so they're not going to admit they made a mistake. So I'm on deceased SSDI, father-children benefits from 18 to 56 years old. Will a children benefit convert to retirement Social Security at 62 also? Okay. So you're on DAC benefits, disabled adult child benefits. No, your benefits, if you're on disabled adult child benefits, that is basically you became disabled before the age of 22. And you were eligible for disabled adult child benefits based on a parent's receiving retirement benefits, disability benefits, and then later deceased, and now you're surviving child benefits, disabled adult child. But even if you're obviously not a child, but you're still child. Yeah, you're always a child in your parents' eyes in some respect. Anyway. But no, you will continue to get regular surviving disabled adult child benefits forever. Because if you're able to get retirement benefits on your own record, then that means you weren't a disabled adult child. You were able to work and pay into it your own. So sometimes you do pay a little bit into it, but you're probably receiving more on surviving child benefits. So no, your benefits are going to continue. So as long as you're disabled. FJ, I have been on SSDI, is that Eddie Van Halen there? For 14 years. I turned 62 this March. Should I file for Social Security now? So by the time I turn 62, I will not have a lapse. I am bedridden and scared, very scared. No, you're good. Don't worry about it. You are already receiving benefits on your own record. Social Security disability benefits. If you're receiving SSDI, not SSI, if you're receiving SSI, then you do have to file for retirement, but you're receiving SSDI, so you don't. So people ask me all the time, okay, I'm on Social Security disability insurance and I'm turning 62. Should I also add my retirement? Well, no, because you can't add it. You can get off disability and go to retirement benefits. Nobody really does that. Maybe 0.1% people that don't want to, deal with the CDRs or something, but nobody does that really. Because you're going to get less. If you stop your disability and switch to retirement benefits at 62, you're going to get 30% less, and you might lose your Medicare. So you don't want to do that. No, you don't do anything. When you turn 62, you don't do anything. You just keep on keeping on. If you're eligible for any other benefits, spouse benefits, divorce spouse benefits, surviving spouse benefits, independently entitled divorce spouse benefits, then yeah, definitely check that out. Remember, surviving spouse benefits you can get as early as 60. So if you were married to someone that passed away, you can start those surviving spouse benefits at 60, and it won't affect your disability. If you're eligible for more money as a spouse or surviving spouse, they will just add that on top of your disability benefits. One offsets the other. So if you're eligible for that, 60, get those surviving spouse benefits. If you're eligible for spouse, divorce spouse, independently entitled divorce spouse, start those at 62. The only other thing you need to worry about is when you turn 65. You are probably on a Medicare Advantage plan right now because that's all you can get. But when you turn 65, you're in a special window where you can get a Medicare supplement plan if you want one. So those come with a monthly premium, but there's no prior authorizations, there's no networks. So yeah, so definitely check that out. And if you need help, Chapter will help you out. And tell them Ed said hi. Let me see. I'm going to try to find some people I've never seen here before. George Beeman. I assume that since I was born in 56, that my 65th birthday, I am at FRA, so I can work with no limits. About 56, yeah. You can, I've got a calculator on, I'm 56, I don't think so. But yeah, they changed the full retirement age back in the 1980s. And if you were born in 1960 and after, then your full retirement age is 67. But 56, I don't think it's 65 at that. I think you're probably at 65 in 2 months or something like that. Elvis, I am statutory blind. I am working. I want to apply for disability I cannot continue working. What's going to happen? So for blind, it's completely different in terms of what's called the substantial gainful activity. Normally for substantial gainful activity for everybody else, if you're making over $1,620, this is 2025. If you're making over $1,620 working, then Social Security says you're not disabled. But for blind, it could be up to 2,700. So if you're determined to be blind, then if you're making under that, you might just want to go and apply. If you're going to be stopping work here pretty soon, if you're making over that, but you're going to stop working, I would start the process. So if you're making $3,000 a month, let's say, and you're filing for disability based on your blindness, but if you're making $3,000, then they'll deny you. But you'll say, well, this is the last month I'm going to be doing that. Starting next month, I'm going to cut back because I can only do a few hours a week, or I'm just going to stop completely. So then they say, okay, perfect. Let's go ahead and start the process. So apply. If you think your disability keeps you from continue from working, then please apply. So John Dugan, I am on SSI and on Medicaid. I am turning 65 in January. Do I need to get Medicare? Someone said yes, but I am on SSI and Medicaid. Yes, if you're eligible for it. So if you paid into Medicare, then yes, you will get signed up for Medicare. And if you're on Medicaid, the higher levels, if you probably QMB, SlimB, SLMB, QI, if you're on those levels, then the state will pay for your Part B premium, that $185 or whatever it is, next year. So, and then you'll have Medicare and Medicaid, and then you'll be eligible for a Medicare Advantage dual eligible plan. Definitely check that out and see if it's something that is good or in your particular case. But if you're not eligible for Medicare because you never paid into the system enough, then that's a whole different situation. So let's see. Aleki, I was approved for the first time. I'm at 24 months from onset date. How do I know I am enrolled in Medicare? I'm 60. Yeah, you should have already received, if you've been on Disability, it's when your check actually started and everything. So yeah, is your address up to date with Social Security? Because when your address, you update your address with Social Security, they also have, Medicare, talks to them, and that's how they get your address to send your Medicare packet. So if you're eligible, so you're at 24 months, so let's say your 25th month is November, you should have already received your packet. So I would call Social Security and see when your Medicare is supposed to start. They'll have it on the MBR, the Master Beneficiary Record. They'll be able to tell you. Or you can call Medicare. You could even call Chapter, and they could see whether your Medicare card has already been sent out and it just went to the wrong address or it got lost in the mail. And they can find your Medicare beneficiary number, and then they'll help you find either, depends on your state, maybe a Medicare supplement plan or a Medicare Advantage plan. So, and their help is 100% free. Let me see, caveat pub. So if you're working, making $1,650 a month and collecting both Medicare and Medicaid benefits, will they take away the Medicaid benefit portion? Okay, so you didn't say whether you're receiving retirement benefits or disability benefits. So if you're receiving disability benefits and you're making $1,650, that's over the substantial gainful activity. And then, again, if you're in your 9 months, then you're good. But if you're receiving retirement benefits, then you're good at $1,650 a month. So collecting both Medicare and Medicaid, will they take away the Medicaid benefit? It depends on your state. It depends on your state. If you're like in Texas or Alabama or something, then yeah, you'll probably lose your Medicaid. If you're in California, because the cost of living is so high, they allow higher limits there. So it really depends on your particular state. So I would definitely contact your state. It's good just to pull the Band-Aid off in these situations. You don't want the nightmare to happen in the future. So if you just started working last month or 2 months ago and making $1,650, the Medicaid is going to find out. So if you just let them find out, they, because of the low staffing, they might not do anything for 6 months or a year. And then you'll have a big nightmare of overpayments, and they'll say, well, all the time you use Medicaid, we're not going to pay for it now, and it's just going to be crazy. So it's always good to just pull that Band-Aid off and call them up and say, hey, I just want to let you know I made $1,650 last month and this month, and I'm going to make it this month, and so I just want to be above board, and I'm making that money, but I'm really pushing myself, and it's hurting my health, and but I need the money, so I'll keep working $1,650 unless I can only work $1,350, and if so, I'll cut back to $1,350, and it's better for my health anyway. So, because here's the situation, sometimes people that receive COLA hate COLA. Remember a few years ago when the COLA was 8.7%, and vast majority of people was like, awesome, 8.7%, extra money, perfect. People on Medicaid or something, some of those hated it because they're like, okay, I made $5 more, but that put me over the Medicaid threshold. And so I lost Medicaid. And because I lost Medicaid, I have to pay $500, $300 more a month for my health care. So you gave me $5, thank you, but then you took $300. So yeah, so you have to watch out for that. You have to watch out for that. Joseph, I'm 60. We are over an hour. I'm going over, aren't I, today? I'm 63 on disability since 2008. In 2022, I moved to Portugal and canceled Part B. If I request Part B again after 65, do I still pay the 10% late enrollment penalty, even though I had Part B prior? Yes. Every 12 months, you did not have Part B when you were supposed to, you're going to pay a 10% penalty for the rest of your life. Every month, 10% is going to be added on to your monthly Part B premium. And your Part D, not 10%, 1%, for every month you didn't have Part D, the prescription drug plan. And if you come back, you can't sign up for Part B until the general enrollment period, which is January, February, March. So if you sign up in January, your Part B will start in February, and it sounds like it's going to be penalized forever. So again, so if you had, if you turn it, let's say you're 75 years old and you had Part B for a couple of years, so you're good. So, and then the other 8 years you didn't, you're going to get an 80% penalty. You won't get the 20 because you had it for a couple of years. So I think that answers your question there. All right, let me get a couple of, Jeff, I had 2 CDR medical in the past year after being on a 7-year cycle for a while. Both times I got a letter about a month later saying they did not need to talk to my doctor at this time. So it sounds like, yeah, someone in the office sent out it twice by mistake. Or probably what happened is the person that was doing CDRs in your local field office, your district office, was doing them, sending out all the packets and stuff, and then they got relocated, vacated, terminated, moved on by Elon Musk and Doge, and so they left the agency and someone else came in there and yeah, they did it twice. So that's probably the situation. All right. Yeah, we're way over. Let me get a couple of more questions from someone I don't recognize. Kelly, what's up, Kelly? McAlien. I'm 64 on SSDI, full retirement 67. If I start drawing my pension at 65, will it reduce the amount I currently get from SSDI? Am I required to take the pension at 65 if it's available to me? Are we talking about a private pension or are you talking about Social Security? Again, as I talked about that other person, no. You're on SSDI. When you're on SSDI, you get your full benefit amount. It's not reduced because you're getting it early. If you start your regular Social Security retirement benefits, I guess what you're calling a pension, okay? If you start your retirement benefits at 65, it's going to be reduced by 2 years, so you're going to get less. So you don't do anything in that regard. You just stay on Social Security disability insurance. Unless they terminate your disability, and then you can go to retirement benefits. But if not, nope, don't mess with anything. Except for, remember, a lot of people miss this. If you're eligible for spouse benefits, surviving spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, get that money. And then when you turn 65, check out a Medicare supplement plan because there is no health underwriting. They can't deny you. They can't charge you extra. So if you have a Medicare Advantage and it's just not your cup of tea, check out a Medicare supplement. And if it's better for you, get it. If not, you just find yourself a better Medicare Advantage plan. And you can do that now in the annual enrollment period. So reach out to Chapter and they'll help you out. All right, let me get one last question of someone I don't recognize. Frank Bama. I'm 78 years old, CSRS annuitant. So that's the old civil service retirement system. It's different now. So he was a federal employee. With Medicare Part A and Part B, my wife has both parts also. We have Blue Cross and Focus. Do you really need Part B? Should I cancel B and buy a better FEH plan with the $5,000 savings? It really depends on a lot of variables. I would contact OPM and ask them because I know, like, if you work for the post office, you're mandated to do Part B now, but I think you're grandfathered, so it's probably not an issue with you. You're not TRICARE. If you're in TRICARE, retired military, then you have to have Part A, Part B. But in terms of Part B, I would reach out to OPM and just double check and say, hey, do I have to have Part B? And then I would contact Blue Cross and say, do I have to have Part B? Because sometimes Blue Cross is giving you some better deals because you have Part B, because they're billing some of the stuff to Part B and behind the scenes and you don't know about it. So, but yeah, if you call OPM and they say, no, we're not making you sign up for Part B, and you call Blue Cross and they say, yeah, it doesn't benefit you at all to have Part B, then yeah, maybe. So yeah, a lot of variables there, unfortunately. All right. One last one. Grace, I will be 65 in December. I have already received my red, white, and blue card. Do I still get C and D? Yes, unless you got $1 million under your mattress or something. Then remember, if you have health insurance from current work, yours or your spouse's, and that employer has 20 or more employees in that plan, then you don't have to get Part B or C or D. then you just get Part A there. But if you don't have other creditable coverage, then yeah, you need Part A, Part B, and then you need to get Part C, which I hate calling it Part C. Part C is the Medicare Advantage plans. So I would call Chapter there, or call whoever you know and trust to check out the plans in your particular area, and they will do a compliant presentation. They better. Chapter definitely does, and they will tell you the differences. Dog, cat, car, truck, Medicare Supplement, Medicare Advantage. They will tell you the differences between the two. They'll tell you, Medicare Supplement, you got a chance of Plan N and Plan G, and you'll say, oh, okay, well, maybe that one's not good for me. Tell me about Medicare Advantage. They'll tell you about Medicare Advantage, and then you'll hear about Medicare Advantage, and oh, wait a second, actually, Medicare Supplement does sound better for me. So you'll just make that decision based on your particular situation. So I would call them. So you're turned 65 in December, you really need to make that decision and get everything started. So contact whoever you want, Chapter, whoever, and tell them that, hey, I need to check around my options because I don't have a whole bunch of money under my mattress to cover all of the gaps of original Medicare. So, and they'll help you out. And if they're not nice and they don't help you out, please let me know. So anybody we recommend, my son and I recommend, we keep an eye on them. And if they're not doing an awesome, perfect job, please let us know. But Chapter's been doing a phenomenal job. So, all right, we are way, way, way over time. I thank you all. Remember, if you're watching this in a recording, please type your questions and comments and your situation, your experience with Social Security disability in the comments there. And then a couple of weeks, and once I have enough, I'll do another follow-up and I'll answer as many questions as possible. Or if you can record a video, just go onto my GovExpert and record a video there. And then I'll answer that. All right, y'all have an awesome, awesome, awesome night. And please, 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 please take care of each other. Bye-bye.